Okay. And then the purpose of today's meeting is to walk through some of the basic workflows that we have in our system. And as we are going through, you're going to think of things that we need to account for. So I'll just need you to kind of jump in, just like we're having a conversation, and say, okay, well, here we need to do X, Y, Z. Okay. And then we'll figure out how we can accommodate that in your specific workflow. Does that sound good?
Does sound good.
Okay, so the first one that we generally start with is your new patient intake. So new patients always go into the demographic form. That's where a client's record begins in ClinicTracker. That form is available by going to patients and then demographics. An easier way to get in there, I feel, is right from this My Patients widget, and you can click this New Patient button. Okay, that opens up this demographic form, and Jeb, as you probably found out, you're able to toggle any of these requirements that you see on the screen. So anything with a red bold label is required. And as I move through this, you can see that on multiple tabs, you have required fields. So on this tab, you'll see a number of things like referred by, referral phone number, referral source, etc. You can toggle these requirements in the options form by coming here to help, about, admin config, options. Then on the preferences tab right here at the bottom where it says demographic form settings, you can see that these settings right here are available where you can uncheck them, and then that field will no longer be required.
Okay.
Okay. So just kind of coming back here, as your staff is entering in a new client, and I'm just going to grab one that we have in here for the sake of time. So you have, sorry?
Background, Alycia?
I'm sorry?
There's some in your background. It's just there's a voice that's kind of loud, or there's the radio or something.
There is, sorry. Bear with me for a second. Let me see if I can fix that.
Beautiful.
Better.
There.
Yes. Wow.
Are you there?
Yes, I'm still here. So I don't know if, is that any better?
No, but that's okay. I mean, it's okay.
Okay.
All right.
Okay, so just kind of coming through here, the social security number that we have in here, you're going to see that you have a requirement in there for the social security number. And then if you have somebody who declines to provide a social security number, this is where you can put in all nines. Okay. So this value is actually omitted from your duplicate checking. So the system's going to look for duplicate social security numbers, look for duplicate patient names and dates of birth, and it's going to alert you if you try to put in a duplicate patient. This value is specifically omitted from that duplicate checking, so you'll be able to have multiple patients with this value in here. Okay. So the first thing you're going to do is come in here, go into the demographics form, enter in all of the required fields. Then you can move over here to the intake tab. This is where you'll see that the patient will be indicated as a child or an adult. The system is going to fill that in for you based on the client's date of birth, just so you know, but you can toggle it either way if you need to. The age cutoff for a child versus adult is set in your options form on that same tab I just showed you. So again, it's help about options, help about admin config options, and then on the preferences tab, that's where you're going to set the age cutoff for child versus adult. Here, where it says type, this is where we can this is where we're specifying if the patient is been formally admitted into your clinic. The intake status indicates that it's a new referral, generally speaking, somebody who's not been seen yet, and they're still waiting for that initial visit so that you can determine if they're a good fit for your clinic or not. The patient versus intake right here.
Mm-hmm.
does a couple things. This starts generally speaking, this will start or trigger your compliance rules. And those compliance rules are something that you'll set up using your dynamic or your compliance workflow builder. Generally speaking, the compliance rules that are triggered based on admission, we call it, are triggered when you change this setting from type intake to patient. And that's just indicating in the system that the client is now formally admitted into your system for treatment. And we can, like I said, trigger those compliance rules at that time.
So, and when would we typically do that to change them from one to the other?
The patient versus intake setting usually happens right after you've met with the client for the first time. And it really depends on how you set up your clinic specifically. So I've seen it where clients go into the system and they're automatically put into the patient setting and people bypass the intake. Other settings, I've seen it that the person will stay in an intake status until they come in for their very first visit. Then the intake coordinator will determine, this person is a good fit for our clinic. We're going to be able to help them. So I'll move them from an intake to a patient. And if, let's say that the client is determined, this is not a good fit for them, but we're going to refer them to somebody else, we can leave this in intake status, but then come over here to the intake disposition. And then these are entered by you in your maintenance menu. So utilities.
Yeah, yep, I got that.
Okay,
Mm-hmm.
so utilities maintenance, and then you'll enter in your intake dispositions, and then you'll be able to track, if you're referring people out because they're, like I said, they're not a good fit, or maybe they just never show up for their first appointment and kind of fall off the grid.
Okay.
Okay.
Does that change type have to occur manually, or is there a way to have it happen automatically when the person is closed up?
No, it's something that you'll do manually so that you can indicate, because if you think about it, you may have a client come in who really needs maybe like an IOP service. And if that's not something that you provide, you might refer them over to somebody else that does.
Okay. So they never become a patient even though they had an intake.
Right. Yep.
All right.
But you'll still be, like I said, you'll still be able to record the intake and bill for it and everything like that. This just more is helping you track your patient load and, what happens with those intakes, especially if they don't become a patient. You're going to want to know what's happening with them.
Yeah. Okay.
Okay, so I'm just coming down here and filling out these required fields. You're noticing as I'm filling them out, the labels are turning black. That just is a visual indication for you that the requirement's been met. If I come down here to where it says patient group, you're going to see that you have a number of patient groups entered. It looks like you've already gotten those in there. These items help you segment your patient population. So you're going to want to put the person into a patient group when they first call in as a referral or an intake. And then you can, of course, change that if necessary once you've met with the client for the very first time.
Okay. So a question for you, Alycia, is do most of your clients, like every phone call that comes in, go on this demographic screen? Or is it they use something else, some other call tracking system, and then put them in here when they actually get scheduled?
Nope. So most clients put the patients directly into the demographic screen, and they'll leave them in the intake status. What happens with this status is, as long as the patient's not dispositioned or changed over to the patient type, this makes the client appear on an intake waiting list that you can then report on and follow up with. We also have these date packet sent and date packet return settings. So if you're the type of clinic that sends out like an information package when somebody first calls, you can kind of use this as a little bit of a CRM where you're putting the patient in. They go into the waiting list. We can say we sent out a packet on this date, and then we could report on that if you have people that maybe call out or something like that.
Okay. So one of the things that we do with our current system is we kind of track different types of leads.
Okay.
Meaning, like, we might have a good lead, which is somebody that can come in during the day, and we might have a bad lead, which is like a particular insurance plan. They can only come in the evening. Are there ways of segmenting it out, or not so much?
Well, there are. I mean, what you might want to do is actually just put your CRM information over here on another tab.
Uh-huh.
And we can do that through the form builder. So just to kind of give you a quick example of that, I'm going to help about. And then right here under form builder, we can go into patient forms.
Yeah.
And I'm just going to just put the CRM in here.
Okay.
And then right here where it says intake patient dash or patient demographics, you can see I'm just making this show in form the intake patient demographics form.
Mm-hmm.
And then I'm just going to add in a tab over here. Okay. And then I'll go ahead and just add a field in. Oops. I'll add a field in here before for your kind of example, and you can come in here and tweak it later if you'd like.
Okay.
So you might want to put in a list box or a drop down. I tend to, if their options are fairly limited, I tend to use list boxes more than I use drop downs, sorry. And that's because of the amount of clicking. So if you have a drop down, it's a minimum of 2 clicks. You click into the drop down and you choose your option with another click. Whereas if you use a list box, it's all of the options are displayed on the screen where you can just press a button. So
You just,
sorry.
yeah, I just want to make sure that everybody's tracking. Are you guys all tracking what she's doing? Okay.
Okay. So in this case, we might just want to say lead type or, and you can obviously adjust this. Then you'll come down here and enter in your list values. So this might be like good lead or, after hours lead or something like that. And I'm just separating them with a semicolon.
Okay.
And then I could even limit this to one selection because I'm using a list box as opposed to a drop down. A drop down by nature only accepts one value. With the list box, it will accept multiple, and then we can put the maximum amount in here. So we're just going to max this out at 1. So now we have this field here, and when I close out of this field builder screen,
Mm-hmm.
then I'll come back over and I'm just going to enable this form right here. And that's going to make it show up at the end of the demographics form that I was just showing you.
Okay.
Okay, so now I'm going to close out of here and I will, I just need to exit out of ClinicTracker and sign back in so that you can see those changes.
So Alycia, while you're doing that, is there a way to have a patient belong to more than one patient group simultaneously?
Yes, so on the patient demographic screen, what you're going to see is that we have a primary patient group in that drop down, but then you also have additional patient groups over here. Okay, so I just logged out of ClinicTracker and back in, and now I'm looking here at the CRM information, which I just added in, and you can see that field's been added over here, so I can start tracking that. And you can even build reports on this information as well.
Okay.
Okay.
Does that make sense? So that, okay. That's where we need your help on the how to workflow.
Okay, so just kind of moving right through here. So just coming back down here to the patient group, this is where you're going to segment out the patients for reporting. It also dictates your staff permission. So if you recall when you put in your staff members, you needed to add in the patient group permissions. This is where that comes into play. So if you have somebody that has access to the ICC patient group, they're going to have access to this client's record, whereas if they only have access to the ICC group but not the insurance or the insurance group, they will now not have access to this client record.
Okay.
Okay. Sorry, just moving along here. Here where it says the hospital number, some places rename this to the client ID if they don't use the word hospital number. You can do that through the custom labels screen. So that's, again, up here through help. about, admin, config, and then custom labels.
Okay.
Okay. And then once you come in here, you just find the form that you want to relabel, or the field in this case, and that very top one on the fields tab is this hospital number. So we could write in client ID or whatever you want to call that. The basic,
Sorry.
is that what you want to call it, a client ID?
Yeah.
Okay, let me change that.
Can it create an ID for us, or do we have to enter in?
You can create an ID. The system can create a client ID for you using this button right here where it says calculate next number. So it's going to automatically calculate a unique number for you.
Okay.
As I move forward through here, you can see here's the additional patient groups. This is where, again, you can specify if the client really falls into this primary patient group, but they're also kind of in this bucket as well. We can specify that over here. The one thing I want to make clear is the additional patient groups don't impact your staff permissions. So in this case, I had said if a staff member has access to the ICC group, they're not going to have access to this patient if they don't have access to that insurance group as well. The same thing applies. This additional patient group is not going to impact your permissions. Okay. Just coming down here where it says program assignments. Once you've changed the person from intake status to patient and you've added this admitted date over here, you might want to track program assignments, and this is totally optional. But if you have specific programs that people work through in your agency, and maybe they work through program number 1 and then subsequently go to program number 2, you want to track those programs separate or in addition to their overall admission, if that makes sense to you. So, maybe they're in the ICC program first from 1019, or we'll say 10-1 through 1019. But they're still admitted into your clinic even though they're no longer in that program. Maybe they move at this point to this program here. We'll say a new. I'll just grab another program, and now we would have a subsequent program assignment. So you can track the history of which programs the patient was in and then subsequently discharged from within this admission through discharge period. Does that make sense?
Yeah.
Okay. Okay, here where it says scheduling groups, if you have scheduling groups entered into your system, which right now you don't, you can add this client into the scheduling groups. Is that something that you work with?
I don't know what it is.
A scheduling group is, let's say you have a group of clients that all come in at the same time every week or every other week. I've seen it be like an anger management or a healthy family relationships group, or whatever the case might be. But if the clients come in all at the same time, we consider that a group. So this would be a scheduling group so that you can schedule them all at the same time.
Yeah, we don't use that at this point, but in the future we might.
Okay. When you do readdress that, just let me know and we can always get back together and I can help you set those up.
Okay.
Moving over here, the discharge status, you're going to see is grayed out until we actually discharge a client. So you would come up here to where it says date of discharge. And then, you would first come up here to where it says status and change it from active to discharged, enter your date of discharge, and then come here and select your discharge reason. This again is available for reporting if you wanted to take a look at the reasons why patients are leaving your clinic.
Okay.
When a client is discharged, I'm assuming they can be readmitted later down the road.
Yes, you absolutely can. So what's going to happen when you discharge a client, and I'm just going to move this back a little bit so you can see. What's going to happen when you discharge a client is it's going to go through what you just saw. It's closing all those program assignments for you. But you'll get this button at the top where it wasn't there before. Now it says readmit patient. If you readmit the patient, another treatment phase is going to be created. So it keeps two different records or as many records as admission periods. So the first admission through discharge would be treatment phase number 1. The second admission through discharge would be treatment phase number 2. So in this case, we'll go ahead and create a second treatment phase. And then you can see it asks us to fill in certain pieces of information again, but it brings all the demographic information forward. Okay, so I'll just kind of go through here and fill this out really quickly. Okay, so now that I've saved this second treatment phase, I have a treatment phase menu at the top. This treatment phase menu is going to follow me throughout the system, so I can toggle back and forth between treatment phase number 1 and treatment phase number 2. So if you have a new clinician on treatment phase number 2, they may want to go back and see what happened before when the client was discharged. So they'll be able to toggle back right through here. Make sense?
Yeah.
Okay, so I'm just going to change this guy back to patient, enter the date admitted, and we'll continue on over here. Here where it says intake clinician, this is where you can specify who the person that completed the intake appointment is going to be specified. And then we have our follow-up clinician here. Here we're going to click into the staff assignments. Now this again is an optional item. Some clinics use it and some clinics don't, just like that program assignment and scheduling group. This allows you to specify who has been specifically assigned to the client's file, and you can also specify the assignment types here. Now that's going to be done through your maintenance menu. Currently you don't have any assignment types in here, so that's why this drop down is empty.
An example of assignment type?
Yep, an assignment type might be like therapist or occupational therapist, nurse, community support, caseworker, etc.
So we probably won't use that just because
That makes sense. I just want to let you know, and I think we talked about this last time, but I just want to specify, if you have any staff members who have this option checked on their additional options tab where it says only access assigned patients, their name would actually need to be specified in that staff assignments module in order for them to have access to the client's record.
So a normal therapist isn't going to have access to all the clients in the system. Is that correct? Like unless they're in that intake clinician or follow-up clinician.
Did you say that they will have access to all of the?
Well, I don't want them to.
Okay, so in that case, they would want to you would want to have them specifically assigned in the staff assignments module. So what you might want to do is, I'll just show you really quickly.
Yeah. So admin is still going to have access to it, right? If we give them the permissions.
Sorry, the patient access permissions are very specific on that additional options tab. So even if you have somebody that has admin privileges, you still need to give them access to all of the patient groups that you want them to have access to. Yep. So if you want to lock down the patient's record, what you can do is have, you can have their name listed here as the follow-up clinician. So in this case, we'll say you are the follow-up clinician. You can click this button that says staff assignments. Then we'll load the follow-up clinician, which is going to bring your name forward, and we'll put in the therapist assignment type and leave everything else alone. Now this therapist has access to this client's record.
Mm-hmm. And so when I set up all the therapists, I'm going to want to click that little box that you showed. Staff assignment, like only allow, only access assigned patient.
Right. Yep. And that locks it down. And as soon as you put an end date in that staff assignment, that therapist will no longer have access to the client's record once that end date has passed.
Okay.
Okay. So just coming back over here, we talked about the intake disposition. The primary place of service, this is just going to default, where the appointments take place for this client. So if you only have one location, that's fine. The diagnosis type, a lot of clinics don't use this, but if you need to specify for reporting, you can do so here. And then the notes at the bottom, Each clinic that I've implemented uses this a little bit differently, but generally speaking, this is where you're going to put the information about why the client wants to come into the clinic. So, if they call up and they say, well, maybe I'm having trouble at home connecting with my spouse, maybe that's what you want to put here so that whomever's following up with them or doing the intake has a little bit of background.
Okay.
Okay. We've talked about the demographic form, so just moving over to outside providers and contacts. This is where you can specify the primary care physician, outside mental health providers, and the pharmacy. If you're using e-prescribing, you're going to want to click this button here that allows you to load from a master pharmacy listing. This will sync up with the e-prescribing module.
Okay.
Okay. And this just allows you to search, so you can see as soon as I click search, you have all of the pharmacies in whatever, that meet the criteria that I've specified here.
Okay.
Okay. Here at the bottom where it says external contacts, I think this is going to be important for your clinic based on what, just the limited discussions we've had so far. The external contacts are people that come into appointments, but they're not necessarily patients, and they might not necessarily have their own compliance requirements. So let's say that this test patient brings in his wife often. We're going to want to specify the wife here under external contacts by clicking add, and then we'll put in the first name. And then we can specify the relationships here. Again, you can specify, or add in the relationship types through that maintenance menu.
Yeah.
Okay. So we'll add in the wife here. As soon as I click the save button, it's going to ask, are you linking this to the test patient? So I'll click save. If you're linking this external contact to more than one patient, this is where you're going to click save and new, and then you could add in the additional patients here by clicking the plus button.
Okay.
But for this example, we're just adding her to one. So is there a question?
In their intake paperwork said some of this stuff, they already listed their wife's name or whatever.
Mm-hmm.
Is there a way that could be put in automatically without us having to retype it?
With their intake paperwork, you mean the paperwork that you would have them complete through like the patient portal beforehand?
Yeah.
There's not currently a way to do that. If it's something that you'd like us to request the development team look into the feasibility of it, we certainly can.
Okay. Yeah, I think basic stuff like addresses and stuff, it would just save so much time if we didn't have to redo it.
Right. Okay, let me just make a note of that really quickly.
I think the other question that came up when we were talking to staff was about in the intake paperwork, there's quite a bit of information that goes directly into the diagnostic assessment. And so there's a question of, can some of that information be auto-populated in a DA?
Okay, so pulling information from this form is actually quite easy. So if you're pulling it forward, we can certainly show you how to do that. But pushing information in here is more of a specific custom development that we would need to get the development team involved with. Does that make sense?
I think so, yeah.
Okay.
Yeah, so what you're saying is, well, yeah, okay, keep going. We'll come back to it.
Okay, sounds good. Just moving over here to the insurance tab, your front office is going to enter in the insurance information here, primary, secondary, tertiary. All of your insurances, once you have them listed in, will be listed here. Right now, you're just going to have this self option listed here. When you have a person set to self-pay, when you go to collect something like a copayment, and I'll just show you here, it's going to give you the anticipated amount of copayment here in the upper right-hand corner, generally speaking, because you're going to be collecting it from a scheduled event or something like that. It's going to take the full amount of the service and put it as the anticipated amount of copayment. So you'll see that as we continue working through these workflows.
Okay.
Once you start taking commercial insurance, I know, or handling that through this system, let's revisit this tab and we can talk about it in more detail. Everything on here is pretty self-explanatory, but as you get closer, we'll just do a quick brush up so that we make sure you get everything in the right spot.
How accurate are the verifications? Like how deep does the information go? How accurate?
So that's really payer specific. I found that Blue Cross Blue Shield sends back very good information. You can see things like co-insurance, co-pays, deductibles, out-of-pocket maximum, remaining amounts on all of those items. And it's very detailed, very coverage specific. So it'll show me the difference between mental health and regular office visits, specialty visits, etc. The Medicaid payers, my experience is that they send not so granular information and it's just really high level. And we still sometimes need to call out to get more information, especially if there's if it's like a silver plan for Molina and there's deductible left over, you don't necessarily get that through the verification module. So again, it's just really up to the payer with what they're sending back.
Okay.
Okay.
Thanks.
Yep. On the financial tab, this is where we can enter workers' comp information if that's pertinent to you. If you're sending workers' comp claims, you'll need to have this information in here. I suspect that that's not what you're going to be doing, but if you ever go down that road, just let me know and we can certainly revisit. Once you take insurances, sorry?
Okay, go on.
Okay. Once you take insurances, you may require insurance authorizations. Those are entered in here. So you would just specify the payer, enter in the authorization code, the allotted number of sessions, or if it's not sessions, maybe it's hours. You would enter that in here. You can see that you have options for tracking based on sessions, duration, days, claims, and allowed amount. You can specify certain services or just say it's for all services, and then you can do the same for clinicians. Once you're tracking insurance authorizations, just so you know, the system is going to alert you if you have expiring insurance authorization. So you're not going to easily run out of units without the system kind of being in your face about it.
Okay.
Okay. Here under reduced fee, if you have clients that you provide reduced fees to, so maybe they're low income, so you give them their services at a lower fee schedule, you can enter those in through the billing tracker module by coming here to billing tracker, then going into settings, fee schedules, configure reduced fee schedules. On here, we can enter a description with a gross income from and to, and then a people size or family size right here. So if you have like $100 to $10,000, 1 to 5 people, for example, then the fee will be $10. In that example, as soon as you have a reduced fee in there, you can put in the gross income and people in family right here on the patient's demographic form. This module right here will fill in with any qualifying reduced fee schedules. They're not going to apply though until you click this button, reduced fee eligible. So even though you put this information in and you see a fee schedule here, it's only going to work when you have this button checked off.
Okay.
Okay. Excuse me. Down here, when you're doing the insurance information, you can specify that the patient's signature is on file and that you have a financial assignment. So you'll need that if you're doing insurance services. Okay. On the info release tab, a lot of people choose not to use this particular module anymore. They choose to make their own information releases through the form builder so that they can send them through the patient portal. If instead you choose to keep this tab on the info releases, you can enter in the authorized recipient. So I'm just going to put in some kind of dummy information here. The relationship to patient will say as an outside provider. I'm just going to grab that. Oops. And we can specify the date granted. You can see that the system defaults this to be a year out. You can toggle that in that same section of the options form that we've been talking about. So if you wanted yours to be good for 2 years, you could certainly set that up. We can also say it's going to end on discharge. And then if you have any default notes that you want to put in there, you'll do so here. We're going to go ahead and view the full consent form. This is where we can specify the authorized information. And what will happen is you'll go into your maintenance menu under utilities maintenance and then just search for ROI for release of information. And then you can put in the types of information that you want to be able to release, and you'll see little check boxes fill in here. And then the purpose of authorization, the same premise, you'll put in those purposes and you'll see little check boxes fill in here. And there's also a section where you can put in the notes. So if you wanted to put in HIPAA verbiage to fill in every time, you'll put that in and that information will show here. Okay. Here where it says patient signature, this is where you'll click collect. And you'll be able to enter in the patient signature here either with your mouse or your Topaz tablet. Once that's done, you'll save and you'll close out of here. Then once you have this authorization on file, you can track any disclosures under that authorization by clicking disclosure tracking. And this is where you can put in your name and the type of information disclosed and the purpose of that disclosure, and then click save. So now you have a detailed record of every piece of information that you gave out under this authorization.
Okay.
And you have your CRM tool over here. So the way that we've entered in a new client, just to kind of take it back a step, is on the ClinicTracker main screen, which is right here. I came up here to where it says add client or add patient. We filled out all of these required fields. I'm just going to cheat really quickly for the sake of time. We filled out all these required fields. We went to the intake tab. We will say enter the patient initially as an intake. They came in, we changed them to a patient because we decided they're a good fit for our clinic, and we entered a date admitted. That's when we specified the follow-up clinician, clicked the staff assignments. We loaded from the follow-up clinician and clicked therapist, and then saved that staff assignment, essentially giving that therapist access to the client's record. Okay, so just keep in mind, you're going to want to think about when that staff assignment happens. It might need to happen before intake if the intake clinician doesn't have access to the client's record naturally. So if the intake clinician is somebody who's locked down with only access assigned patients, you'll want to make sure that staff assignment happens before the client comes in the door.
Yeah.
Okay. You'll specify the patient group. You'll enter the client ID. This is when, maybe at intake we can enter in the outside provider information and the external contacts. We can specify the payer information. If you're going to handle reduced fee schedules, you'll want to do so here. Any releases you can collect on this tool. And then, of course, we have our CRM information that we added in. If you want to move these tabs around so that you're doing things in a different order, you can do that as well. So maybe you want to put in your CRM information right after demographics, for example. We can do that. Oops. I'm just going to close out of here. We can do that by coming up here to help, about, form builder, and then right here where it says configure tab order. Okay, this is where we're going to specify the tab that we want to look at, which is the patient demographics. And you can see we have all of our forms listed here. You can tell which ones are stock and which ones are custom. So let's say you looked at that info release and you decided I would prefer to use a custom form. So I'm going to right click and hide this tab. Okay, that tab will no longer be visible. Nobody will accidentally use that built-in information release. Here is the CRM information tab that we built in, but we want that to appear right under demographics. So I'm just clicking and dragging. Okay, and then maybe I want the intake tab to appear after that. Okay, so when I put those settings in and then come back into the demographic form, you can see things are rearranged quite a bit for me.
Okay.
So that just allows me to kind of work through in the order that makes the most sense for my office.
Okay. And in the demographics tab, can we add things to that, or is that because of the stock tab we can't?
Because it's a stock tab, you can't, but you can always add in another tab here. So if you wanted to do like demographics 2.
Okay.
Okay.
Yeah.
Yep. So if you wanted to add a tab in there, you would just come up here, back to the help about form builder. You would just grab the one that I already embedded in here and press this plus button.
Okay.
And then you would save that change. And then of course you could rearrange the tabs in the way I just showed you. Okay.
Yep.
So I'm going to exit out without saving. But you can certainly go in there and play around with how you want it to look.
Okay.
Okay. Okay. Sometimes what I do also on the demographics form, just so you know, is I'll put in a next steps over here. So on intake, we often have questionnaires we need to do. Sometimes we do that right on the demographics form. Sometimes we do that as a standalone form. So that's totally up to you how you do that. But you would essentially build in your rating scale or your survey into the form builder. And then you can build a next steps tab that has links to other areas of the system. So in the form builder that I was just showing you, you would use a navigation link to point your clinician to the next form that they need to complete. Does that make sense to you?
No, I'm not quite following.
Okay, so let's take a look. I'll give you an example here. Okay, so I'm just going to use this same form, and here I'm going to put in a next steps tab. On the next steps tab, what I'm going to do is I'll come down here and then go into the navigation link field type. So the navigation links allow you to move through the system in different ways. So in this case, we're choosing a form navigation link. You'll see that you also have the ability to add in like a message. So if you after you enter in an intake and you enter all the CRM information, maybe you want to notify the intake clinician you have somebody coming in. So you might put in a message link as a next step, just as an example. You could also, have it be a report that you want to run. Okay, so for our example, we're going to say it's a form, and maybe we want it to be the admission note, just as an example. So step 1, we'll say complete admission note.
Okay.
Okay, that just puts this little link on our tab.
Uh-huh.
And then on the demographics form, after you complete your intake, now you're going to see a next steps tab, which is going to appear right here at the end.
And then when they click on that, that's going to take them.
Yep, takes them right into that next form.
Into the admission note.
Yep. So that's generally speaking how I guide my users through what I want them to do. There's some webinars that we can send you that give you examples on how you can build those rating scales and use the tools like conditional visibility. So sometimes what I do is say, well, let's say I have a rating scale and the score is a 5. Because it's a 5, I want this link to show, but if it's not a 5, I don't want it to show. So there's logic I can use to hide the next steps that I don't want them to take based on another criteria.
So for instance, if we had the Beck depression inventory on there and they scored above 7 or something, then that could be like a conditional that they should, I don't know, fill out something.
Yes, exactly. Yep. And again, it's up to you. Some clinics don't use these next step tabs and they don't do this conditional visibility. Instead, they will just use their compliance workflow builder, and the compliance workflow builder will take you through, will take you through or allow you to build rules that say, if this rating scale is completed and we meet this other criteria, then this other form is due at a certain time. But this takes it away and kind of puts it into your compliance due dates, which isn't necessarily as front and center. You might want to just have it right on the form, and I find that to be the best practice for the clinicians I've been working with more recently.
But the next step tab is more helpful. So
Yeah.
would they have to go in there each time to look for that, I assume?
Well, I put these next steps in all over the place. So, that's what I do personally if I'm, implementing somebody or they're having me build the forms for them. Let's say I build a rating scale and I know, if you're between a 0 and a 5, we're going to need this other report filled out, or we are going to need to schedule something with the client. We'll put in, next steps based on the rating scale. Rating scale equals 0 through 5. Show me the admission note. The rating scale equals 6 through 10. Show me a different form. Am I making sense?
Yeah, I think so. Yep.
Okay. So these next step tabs are, like, again, just something I build in throughout paperwork items.
Okay.
Okay. On the demographics, I also see a lot of people do things like add in consent forms. So here's all the consent forms I need to have, and then we'll put in the dates completed over here.
Okay.
Okay, so that's, again, something that you can learn to do using the form builder webinars that we're going to send out to you.
Great.
Okay. So just moving through, we've talked about the intake and how to enter them in, how to admit a client. And I'm just grabbing this patient again. Now, what you're going to want to do once you have the client in your system is schedule the first appointment. So you can do that by coming up here to Actions and then Schedule Appointment. You're going to notice that there's two options, Search for Time Slot and Open Scheduler. If you have clinicians in there where you've scheduled some availability, and I think, Jeb, I showed you how to do that last time we spoke, you'll be able to use this Find Available Appointment feature. If there's no availability configured, you'll see something like this. There's no availability.
Can I just explain real quick to like what you're saying?
Yes.
So the nice thing about, I'm talking to the group over here. The nice thing about how they set things up is you can have priorities of clinicians, and so then you can search for a time slot, and it'll give you according to the priorities of the clinician. So okay, go ahead, Alycia.
Sure. So so we have this Find Available Appointment feature, or you can just open up the schedule right from here. So it's Actions and then Schedule Appointment and then Open Scheduler. Because I just want to show everybody how to move around the system, I'm actually going to go in there manually and show you a different way to get in there. So instead of going from the demographics form Actions, I'm going to close out and just come right down here to where it says My Schedule. You're going to notice that I can also get into the scheduler this way by clicking My Schedule. Okay, what happens is the schedule opens up. On the right-hand side, you're going to see a resource display. This shows you everybody who you have access to. So typically speaking, clinicians only have access to their own schedule, so they'll see their own name here. If you're an administrator like me, and you're going to see everybody's name. And of course, Jeb knows how to now add permissions for everybody. So I think, Jennifer, when you log in, you're going to see anybody's, or you'll see at least Jeb's schedule. You can also add in patient. So if you want to see a patient's name next to your own, you can click over where it says patient and then select the patient. Now I can see both side by side. I can even come over here to where it says staff and then unclick my name and just see the client schedule. So it's really up to you how you want to look at this. In addition to the staff and the patient, you can also look at rooms. So if you wanted to see various rooms, those are entered through your maintenance menu under the room input, and you could schedule things out based on the room. Okay, so for our example, I'm just going to look at a staff schedule. So we're looking just at Jennifer's schedule, and I'll go ahead and double click. Actually, I think Jennifer's an other user, so I'm going to use Jeb's schedule. Okay, so we'll go ahead and double click on the time slot that we want to use. You can see it's already defaulted time and date to the item I selected. You can see Jeb's name is selected here because that's who I'm looking at on the scheduler. Here where it says link to patient, I'm going to just press this plus button and grab my test patient. You can see that the name fills in for me up here. If I want to relabel that, I certainly can. This is where I'm going to choose my location. And you don't have any rooms entered, so we'll just leave that blank. Then we'll choose the service and the program, and we'll leave the payer alone. And this is where we're going to say create patient contact. What that does is it creates the entry in the patient's treatment history for us, where the clinician can then pick it up when the client comes in. So rather than the clinician having to make that on his own, the front office will do it and put it in what's called a pending status. Okay. What this does is it gives you the item for tracking, where if the client comes in, you can mark them as showed up, or you can mark them as a cancellation. Does that make sense?
Yes.
Okay. Now, a couple things I'm seeing right off the bat here. Your default is that this is going to go into a showed up status. So that's certainly fine if you're not making these client contact records until the client actually comes in. And some clinics choose to do that because they don't charge cancellation fees and they don't track no-show rates. And so they don't even make these client contacts until a patient's in front of them. So that's up to you. Do you have a sense if you would create these ahead of time or if you wouldn't need them?
I think we would create them ahead of time just because we want to track no-show rates.
So a couple things I'm going to do. I just want to toggle some settings here for you. So I'm going to close out of here. And I'm going to come back to the options form. So going into help about, admin config and options. Over here on the admin tab, I'm going to default the linked appointment status to pending. You can see I carried the supervisor forward, and I did that last time we talked. I'm also going to come over here to the preferences tab, and this is where your patient contact form required fields are. I'm guessing you don't use a GAF score. Is that correct? No. Okay. So I'm going to get rid of that requirement. And then I also am going to eliminate the requirement for the diagnosis because you can't put in a diagnosis before you see the client. So we'll get rid of that requirement. Just keep in mind you'll need the diagnosis when you're locking a progress note. Okay. So now I'm going to go back into the schedule. I'm going to look at Jeb's schedule. I'm going to open up that scheduled event I created earlier, and I'm going to create the patient contact. So now when I come in here, it shows up as pending. The service came forward, Jeb's name came forward, and the program is specified for me. Once you start using insurance companies, we're going to care more about this auth code field, but right now we'll leave it alone, and we'll just save that for now. Okay. So before I keep going, are there any questions on the process of scheduling?
Is this just for patients, or is this where we go in and schedule like an all-clinic meeting?
You can schedule an all-clinic meeting as well. So instead of just using this a link to patient, you'll just come over here and add in additional staff members and call it a staff meeting or whatever you want to call it. Okay. And you'll notice because I don't have a patient, that create patient contact button is grayed out, and I just can click OK. Okay, so now Jeb has a couple of things on his schedule. And I'm just going to pop over and pretend to be Jeb for a second so everybody can see what that's going to look like. Okay, so this is what Jeb's main screen is going to look like now. Under his My Schedule event, I have a couple items showing. I have my client appointment showing, and I have a staff meeting. The one thing I want to caution you on, and a lot of clinicians tend to make this mistake or confusion at first, here under My Schedule, these are just items on your calendar. They're not items in the patient's treatment history. So although you have an appointment with a patient showing here, it's not the client's treatment history. Nothing's going to be billed based on your calendar. This is simply your calendar. Okay. When I scroll over and I look at linked appointment, I see yes. That means to me that an item in the treatment history has been entered and an item for billing has been created. And that's done through that patient contact screen that I showed you. Okay. So over here, when I come to my appointments, this is where I'm seeing this that patient contact record that I created. So when I click over here, it brings that record up. Of course, Deb doesn't have the necessary permissions, so let me fix that really quickly. That's probably one of the most common things I see when people first start getting into the system is they've given themselves the appropriate program access permissions, but no access to patients. So we're just going to fix that really quickly. And we'll try, we might have to log out and back in. Yeah. So you saw how I added those patient permissions?
Yeah, I think so.
Okay. So I'm just going to double click, and that opens up this patient contact record here. And you can see this is where I'm going to want to mark it as showed up once the client's in front of me. Now, some clinics have their front office do that. When the client comes in, they pull up the patient contact record, change this to showed up, collect a co-payment right here. And here's where I was talking about that billable service directly to the client.
Yeah.
So it's telling you the price to collect. So this is where we might want to collect the money. And we can put in a reference number, or you can have the system generate one for you. This is where you'd collect the co-payment, and you can choose to generate a receipt or not. And now that client's essentially paid for their services. Okay. So if that's how you handle your check-in, then Jeb, you'll come over here back to your My Appointments widget once you have the client in front of you. Double click here, that opens the patient contact. You can enter in the diagnosis assignment by clicking the C button. It's going to ask you, do you want to load the latest diagnosis information? That's really only relevant if there's something already in there for the client. But basically, you know, we might know that you previously had 2 diagnoses entered, but you're changing it to have 3. Something like that. Here on the diagnosis assignment module, this is where you can enter in the date recorded, the effective date. So, you know, sometimes I see clinicians enter these a couple days later. So you might need to backdate this. That's just something to keep in mind.
Okay.
In the middle, this is where we want to actually add in our diagnoses. So we'll come over here to this plus button. That opens up your DSM-5 guide, so you could type in your keyword.
Mm-hmm.
And then find the diagnosis that you want to use.
Okay.
Okay. What you're going to notice is as I move through these items, the specifiers tabs at the bottom are changing. So each diagnosis has its own specific specifiers at the bottom.
Yeah.
I can come down here and add in additional coding notes, and then mark a diagnosis as provisional if I need to, and then indicate the specifiers here. When I'm all done, I'm going to click select. That diagnosis has now been added into this middle section here, and I can repeat that process as many times as I need to.
Okay.
Okay, when you have multiple diagnoses in here, you're going to need to have one at the top that's the primary diagnosis. That becomes more important when you're billing for insurance. You're just going to want to make sure you indicate the primary diagnosis. And you just, like I said, you just do that by moving the item to the top. And I just highlight these and use the up and down arrows.
Yep.
When I'm all done with this, I need to lock it. Okay, the word lock in ClinicTracker means nobody can come behind you and make changes unless they have special permissions. Okay, so you're going to want to lock this and then save and close.
Could you do that? I mean, could the whoever the user is that's doing it, can they go back and unlock it?
No, only administrators can make certain changes. So, and they're very limited. So you're not going to be able to make changes to these diagnoses. You would actually have to delete it by coming up here to File and Delete, and then enter in a new one. The only thing you can do as an administrator for diagnosis assignments is adjust the start and end date.
Okay.
Okay. Let's see. Just so you know, once you delete a diagnosis assignment, you don't truly delete it. You just kind of mark it deleted. So it's always going to be available here if you want to show the deleted diagnosis assignments.
Okay.
Okay. When you're ready, you're going to click on the progress note button, and you'll see these progress note templates that are available in your system.
Mm-hmm.
Okay. And it looks like you've already played with those settings. So I see that you have some progress notes entered in there. The system's automatically going to ask you if you want to load from a previous progress note. And that's because we know that they're often similar between sessions. So in this case, we're going to say yes, just so you see what that looks like. If you had previous progress notes entered on this client's record, all of those items would show up here, and you'd be able to select the item you want to copy and essentially paste into the new progress note you're creating. You also have the option of loading from a different patient.
Okay.
I would just really caution you when you're loading from a different patient. Excuse me. And the reason is because I've seen where people have not changed the client's name. So I just want to throw that out there as a caution.
They're disabling that option
for loading from a different patient or copying.
Loading from a different patient.
That's not a specific. We can eliminate the option to copy, but not load from a different patient. Okay. On these progress notes, they're all very easy to use, so you just kind of click the boxes that you want to put in there. On any text boxes, you're going to have the option to click F2 and use your common phrases, which it looks like you've loaded in here.
Yay, Jenny!
One of us spent a lot of time typing those out.
Yeah.
That's impressive.
I mean, you should go down. There's like
411.
411.
I'm giving you your clinic wins the gold star for today, I think. Okay. So you'll just move through these tabs here, and of course you can use those common phrases to fill in where you can. Text boxes also accept the any kind of dictation software that works with Windows would be fine. Here on the treatment planning tab, this is where you can specify your goals and objectives that you worked on today. If you have any active goals and objectives on the treatment plan for this client, they're going to show up here where you can just import them. When you import them from the treatment plan, it's reportable. So we can see how many goals and objectives you worked on from the treatment plan versus from not, having manually entered them. If you're entering them from the treatment plan, we can measure the progress on each of the goals through the reports that are in the system.
So most of the time when you have just like a DAP note, it doesn't have the treatment plan integrated into it, that you're updating the goal each time. I don't know if, like, I'm just trying to figure out, because that seems like a lot more work to have to go through the treatment plan every time.
Well, let's say for this patient, I'm just going to close out of here and enter a treatment plan for him really quickly. Now I'm going over to his treatment plan, which is actually in the paperwork menu, but I'm going to do it right from this navigation button here. So I'm going navigation, paperwork, and then treatment plan.
Yeah.
Okay, and so if I enter this in, and I'm going to just kind of go through this really quickly and enter in, I don't even know if I can. Okay, so you'll need to enter in some problem domains. See, when you have the goals on the treatment plan, they'll just be entered in here one time. So you're not going to have to go into the treatment plan every single time. You just kind of grab the goal from the treatment plan that you're working on once they've been entered in here. Does that make sense?
Yeah.
Okay.
Oh, definitely. I'm just thinking, it's another step that they don't have to do right now.
Okay.
Yeah.
Well, if you don't want to use this, you don't have to. So that's totally up to you. And you don't need to pick them from the treatment plan. You could just manually enter or just not enter anything at all.
Just not have that type, because I think we're going to have to end up doing is creating our own DAP note. That's just my guess, because when I looked at the DAP note previously, it didn't have like an intervention tab.
Okay. Intervention, like a modality, is that when you say intervention, is that what you mean?
I'm not sure what you're referring to as far as modality, but like what the clinician did in session.
Okay.
Like clinician administered the Beck depression inventory.
Understood. Okay. So, in that case, we could certainly add on to the DAP note and then adjust it in the way that you need to right through the form builder. And you would do that in a similar way to what you saw me do with the demographics form this morning.
Okay. But the DAP note is a standard one, but standard forms we can add tabs.
Mm-hmm.
You just change the okay.
Yeah, you just can't change the existing tabs.
Okay.
Okay.
If you copy and paste it from another week, do the goals copy and paste too, or is that separate from what you're doing right now?
The goals, I believe, are separate from what you're doing right now.
So when you'd say move everything forward, it wouldn't move all the goals forward.
Right. It would be the narrative.
It'd just be the narrative and all the boxes.
Right. Okay. On the meds tab, this is where you would perform a med reconciliation if that's important to your office. It's more used for meaningful use, but I do see a lot of clinics use it that aren't meaningful use. So this you can import from the med history if you're using e-prescribing. Any recently prescribed medications within this day range is going to show up. Otherwise, you can just manually type it in and then indicate a med reconciliation was performed. Just moving through these tabs. On the psychotherapy notes, you can hide this tab through your options form or you can leave it, but just to explain what it is, we view this as a separate section of the progress note. So if you were to print and export all of the progress notes, you would actually have to specifically click another button to include the psychotherapy notes. We do that because in some jurisdictions, if a client requests their record, the psychotherapy notes belong to the clinician, not the client. So the clinician has the option of providing them or not. Does that make sense?
Okay. Yes.
Okay.
So
when you're all done, you're going to click sign at the bottom, and then you'll enter in your ClinicTracker password. That's going to affix your electronic signature. If you've entered a signature through your staff info form, the image is going to appear in this box at the bottom. Even if you don't have a signature image entered, it will still electronically sign just by having you put in your ClinicTracker password.
So you don't want to make your ClinicTracker password too complicated, because I think the one that's automatically sent out is pretty difficult.
Right. Yeah. You probably want to change it to something a little bit easier for you to remember. Okay, so here where I'm just going to cheat a little bit and say no clinician signature is needed, but a supervisor signature is, just again for example. If you require a supervisor signature, you'll come up here to where it says send paperwork notification and you'll choose clinician to supervisor. In this case, I don't have a supervisor listed because I didn't specify one on the patient contact record. So I'm going to come out here and then I'll just specify a supervisor, then go back into that progress note and you'll see that the supervisor's filled in for me now. Okay.
Uh-huh.
So, sorry?
Sign off. Then it gets sent to the supervisor to sign off.
Well, the system doesn't know when the clinician's ready to send it to the supervisor. So you'll just need to come up here to where it says send paperwork notification, clinician to supervisor. And then all this is filled in for you. The supervisor gets a link back to this progress note in his or her message board, which is right over here.
Oh my God, that'll be crazy. Like I'll have like 30 messages a day. Is there a way that I can just?
Because the way we do it now is we go in and we just sort of check it ourselves. We don't get it sent to us. So is there a way to not?
I guess the question is, do I have to do that, or can I just run a report that says these are the ones that need to be signed by a supervisor and then go into those?
Well, okay, there's a different way to do it. If you don't want people to manually send in, I'm just making you the supervisor on this one, and I'm going to change this around a little bit. Oops. Okay. So instead of using this button, what we'll do is when you have your name listed here, what will happen on your My Appointments widget, I'm just going to refresh this. You can change this to show me all of the unlocked appointments where I'm the supervisor.
Okay.
Okay, and now it shows you this is unlocked and you're the supervisor. And you'll see I just looked at today, but you may want to adjust your date range depending on when the last time you signed everything is. Then you'll just come through here and you can click through each one.
And then sign it.
And then sign accordingly. Yep.
So the appointment can't be locked until both the clinician and the supervisor have signed?
It's really up to the settings for each staff member. So a lot of staff members probably don't require a supervisor signature. And that's something that you'll specify on their staff info record. If they're specified to never require supervisor signature, the system's automatically going to fill in none needed here. And as soon as the clinician signs, it's going to give you this message here.
Okay, so, but we can, when we set up the whole system, we can set it up so that it's sent to an insurance company before they have the note done. Is that correct?
Yes.
Okay.
Yep. Okay, so all required signatures have been locked or entered, so it's now telling you that this record's going to be locked. And again, that just means nobody can come behind you and make changes. Okay, so now I have this record is locked. I can see everything. Excuse me, I can see the last modified date right down here. When I close out, you're going to see now that this item has a locked record menu here. This is only going to appear to those folks who have edit locked record permissions. And if you recall, Jeb, from the other day, that was a setting on the staff info record user responsibility tab. So if you have access to edit a locked record, you can come up here and do it right through this menu. So you see like things like edit locked record or unlock the progress note. So let's say a clinician came to you and said, I made a mistake or I forgot to enter a note on my progress note. You might want to just unlock it for them so they can go back in and re-sign it.
Okay.
Okay.
So the clinician usually update the appointment status. So instead of showed up, it would say, completed or something like that?
No, showed up is the status you want for billing. Once you go over into the billing software, we'll kind of talk about that during another session, but showed up is what's going to cause for regular patient billing. And we'll just leave that alone. It's the pending status that you don't want to see because that doesn't go for billing. Any of these cancellation reasons that you have in here will go to billing, but they'll go at the cancellation fee that you specified when you set those up.
Okay, but the clinician has access to the screen, right?
Oh, yes.
Okay, great.
Yep. In fact, what I recommend at the end of every day is that the clinician check their My Appointments widget because essentially what you want to do is make sure, that everything is showed up and locked, or if it's not showed up, there's a cancellation reason. If you see something that's pending, it means that you're not going to bill for that. And then you also want to check this progress note status. So that's right here on this widget, and it's pretty easy to kind of manage through there. Does that make sense?
Yeah. Mm-hmm.
Okay. So today we've gone through things like entering a new intake. We've entered in scheduling events. We've created patient contact records. We've moved them from pending status to showed up, or we've talked about the billable cancellations. We've gone through progress notes and entering those in. So at this point, what I'd like for you to do is go back, take a look at our example workflows, and we can certainly send you that link as well when I send you those webinars, Jeb. So take a look through those. They're going to reiterate everything that I've gone through. And you'll just want to practice, get into the system and practice. And that's when you're going to start thinking of things that you didn't think of today that we need to account for. And a lot of times you're going to be able to kind of work yourself through the settings by going into the options form or the maintenance menu, or even building on using that form builder. But other times you're going to run into a question that you don't know how to work through on your own, which is absolutely fine. You can come up here to the user support portal and enter in a support ticket by clicking that blue tab right on the right-hand side where it says support. And you can submit your questions individually here. If it's something that's more complex and you want to just get onto another call like today, you just hold those questions and schedule another time with me and we'll work through them together.
Okay.
Okay. All right. Any questions before we wrap up today?
Yeah, I had two. Under when you go under my patients and it's the demographic tab,
Mm-hmm.
you had all the red. You had to fill them out. You know, they're required.
Yes.
We're allowed to those requirements, correct?
Yep.
Not like we don't need race required.
Yes, that's something you can toggle on the options form.
And then my other question was under if we change our fee for service, like we give it a lesser fee, do we have to fill out? No, we don't.
No,
okay.
We don't have to do that.
Perfect.
No. And the question I had is just about the colors. Can you help me to remind me like what how those are used in general? Like I noticed that there's blue over in that bottom right, and then I know when we look at the staff schedule, there can be certain colors.
Yep. So the blue and the black here are just to help you identify different appointments. So you'll see them alternate. It'll just be blue, black, blue, black, blue, black. If you had multiple patients on one scheduled event, you'll see them. You'll see the event listed once for each patient. So for example, if you had two patients, you would see two lines. Both lines would be blue to indicate they're on the same appointment, and the following appointment would be black.
Okay. All right.
In the schedule, you can see work hours here. That's what you're seeing in this white, and then outside your work hours.
All right.
Blue. And then when we come into this, these items here, you can actually specify the event type color. So that's where you where you've selected green for ICC, and that's right through the maintenance menu. So it will actually color code your appointments on the schedule.
So event type would be like you said, staff meeting or like intake or okay.
Yep. So I generally see things like intake, and then sometimes I don't know if you handle crisis type things, but I see that as an event type fairly often. And then just trying to think of other things, staff meetings or personal appointments.
Mm-hmm.
And then I'm just trying to think of other color coding areas. On the patient contact record, if you've indicated something as not billable, so let's say you've decided that this item is not going to be billable, if I click DB, it's going to turn this item red. So I'm actually going to do that right through. Okay. So now this item shows in red because it's not billable.
Okay.
Okay. Any other questions I can answer for you?
I don't think so. I think that's it. Yeah, if you could send those links, that would be great. And
okay. Okay, so I will render this recording. It does take a little bit, so once we have that ready, we'll send it out to you. In the meantime, either myself or Donna is going to send you some links through the support portal. And of course, if you have any questions, certainly reach out to us and we're happy to help you through it.
Okay, thanks so much, Alycia.
All right, thanks everybody.
Thank you.
Bye-bye.
Bye.
Boy, wow, I feel like I should have played